So Assalamu alaikum, again we are here. Today we will not discuss any topic, but I'm here to advise my junior friends and my colleagues that which apps we have to use in our medical practice, and especially for those our juniors, naive juniors, who have recently started their trainings, and those house officers which who are very naive to this clinical practice and just recently started their house job in different institutes. So the one free app, the very important and the free of cost app is Medscape. You can easily get this app, Medscape app, in both and for Android from the Google Play and your Apple Store. For Android you can get this Medscape from Google Play, and for iPhones from Apple Store. So this is the important app. You can find all drug interactions, drug dosages, the major diseases, especially which you gonna discuss in your clinical practices with your seniors and the juniors. So you can actually get very enough data without evidence, but there are evidence. But the problem with the Medscape is that it is not updated as up to date is actually, but the up to date is obviously up to date is another app for those who are not very much familiar with up to date. We will discuss later on the Medscape. So I would advise every junior and especially my every junior that use this Medscape since day one. I have been using this Medscape for last 7 years. When I started my house job in 2013, then I downloaded this Medscape in my Android cell. So I've been using this Medscape. So second, and the one more thing important with the Medscape is that the discipline which you are interested, like if you are interested in the cardiology, so if you entered your all data, and if you will tell them about the interest of your discipline, they will send you the latest data and the latest studies at your email address. So I have suggest you all your guys to download this Medscape if you gonna use, especially if you are surgeon, or especially if you are physician. Second thing is up to date. Obviously up to date is the most common and famous app. You have to use it, but the subscription for students is $100 USD per year. So it is bit costly for the developing countries and those students who are actually living in the Pakistan or in any third world country. So you cannot use these apps because it's bit costly, because it costs you around 100 USD per year. But it can give you a 2 subscription. You can subscribe this app in 100 USD for 1 year for 2 subscription. So you can use it. But I would rather suggest you that if you are not a student of advanced studies or the post graduation, you can use this Medscape as well. If you are even though you are a student of general medicine, or you are not the student of the subject specialty, then you can use this Medscape. But especially for us, for the cardiologist, you have to use this up to date. You have to use other certain apps which we now gonna discuss. So first was the Medscape, second is the up to date. Up to date is for the subject specialty, and it costs you around this. What are the other free apps which you have to use? Medcalc is a very efficient app. It gives you the calculators of so many scores, so many calculations which we frequently use in our clinical practices, such as the ECG reading, QTC according to the EP studies. So and the creatinine clearance, so like Chadwell's scores and clip. It has any calculator which you gonna use in your medical practice. So, and it is also free of cost. It is free It is free of cost. So I would advise you that use this MedCalc with you and download this app. It has also present for both for Google, like Androids in the Google Play Store and the Apple Store for iPhones. So this is again the third important app which is free of cost, okay, for Google and Apple Store for the Apple iPhone users both. And now the other things which are essential for cardiologists, you have certain apps which are also free of cost. One is AHA guidelines. They are also present at the Android and Google Store and the Apple Store, and ESC guidelines. You have to download these both, because anytime when you are looking your patient, so you have to get the evidence, or you have to recheck your treatment through these apps. You can check these apps as well. It has not the detailed data, but it has the recommendations. It has recommendation. So if you want to go for the detailed data, you can go with the with their references through Google. So I would rather suggest you use these two things, use these two apps with, especially if you are a cardiology fellow. If you are a cardiology fellow or cardiology dip card, you are diploma in the cardiology, you are doing the diploma in the cardiology, then you need to download the Medscape and these two things. If you are a cardiology fellow, or if you are a cardiology specialist, you have to obviously buy the up to date, because in up to date you will get all the recent data, all the recent recommendation which are yet to be present, yet to be recommended in these guidelines. You will get all these things in your up to date. So these are the things actually which I wanted to share with you guys. There are a lot of all other apps, but these four apps, these five apps are actually important. Number one, Medscape. Medscape is the mother of all because it is free of cost and it has an extensive knowledge. It has extensive it guides you for the dosages and the warning and the drug interactions, all these things. And the second thing is up to date. Obviously, up to date is, it costs you around 100 USD in a year for student subscription, and especially if you are a cardiology fellow, then you have to download these two things. AHA, if you search it with the AHA guidelines in the Google app, you will get this one, and ESC cardiology guideline, you will get also this one. And the most important is Medcalc. Medcalc is for everyone, for like if you are a medicine fellow, if you are doing your any clinical practice, so you have to download the Medcalc. So I hope that I have made myself clear. Please subscribe my channel for my future videos, and press the bell button for the future videos, and subscribe me for get my future videos and the future updates. Allah Hafiz. Take care. Allah Hafiz.